Hey everybody, it's Dr. Dave Psychiatry. Thanks for coming to the channel today. Just wrapping up my morning here in the office. Jumped in the studio and I'm making a video, another product-specific video today. This one is about Xanax, alprazolam. So Xanax, alprazolam is the generic name, is for some people, very controversial, very scary medication. The truth is, it is a tool that we use every day for people that have a deficiency in their brain of GABA. So our understanding of Xanax and how it works is that you have a chemical in your brain called gamma-aminobutyric acid. And we call that, because of the GABA, we just call that GABA. GABA is a naturally produced chemical in your brain. It is what we call an inhibitory neurotransmitter. That is to say, it's like the brakes on your car. It slows things down. If you don't make enough GABA, then the net result of not having enough GABA is that your other systems tend to overfire, as far as we understand it, and that leads to anxiety and very often panic attacks. So if you're having terrible anxiety or terrible panic attacks, Xanax, alprazolam, is a medication that we use to help people every day. Now, what's the rap against Xanax? Why don't people like it? Well, Xanax can be an abused medication. It's a medication that some people take and they shouldn't take. So if your GABA is low, that is to say, should be in the normal range, but if it's down here, what we believe about that is that being low on GABA, having low GABA activity, that leads to panic and anxiety attacks. So GABA is a GABA booster. That's what it does. It takes your GABA activity from here to here, and in so doing, once you're in here in the normal range, typically the panic attacks and the anxiety attacks and the situational anxiety is all much better. So there are other videos about this, and you can watch this in different types of stories, which sort of gets to the repetitive aspect of this channel because you hear this in other places. But on the very specifics about this particular medication, Xanax is a medicine that fixes that all the time. And we use it on a routine basis. I wrote prescriptions for it all morning. I probably wrote 5 or 6 prescriptions this morning for Xanax in itself because it's a very useful tool for a lot of people. What happens if your GABA is normal? If your GABA is normal and you take Xanax, well, then you feel impaired. So if your GABA activity is too high, then you feel drunk, drugged, stoned, not yourself. And people who like to feel intoxicated, they will use Xanax when they should not be taking it. And basically those people are the ones that are abusing Xanax. They should not be taken in the first place. And those are the ones that cause the problem for Xanax. So if you hear something that, hey, Xanax, that's a benzo, you shouldn't be taking benzos, those are bad drugs. Well, if somebody's using them to get high, to feel drunk, to feel intoxicated, then you're absolutely right. They should not be taking them. But that's the fault of the person taking the medicine, not the medicine itself. If you have a GABA deficiency, then you need something to boost your GABA. And even though we have 4 or 5 other tools that we do that with, one of the chief ones that we use is Xanax, alprazolam. So even doctors sometimes will say, I don't want you to get that medication. It's a problem. People abuse it. It's addictive. So I'm not going to give it to you. Well, if you've got a GABA shortage, we're not going to treat that with an antihistamine. We're not going to treat that with a serotonin booster. So the basic logic of brain chemistry and the tools that we use to teach brain chemistry treatments, like I've done on this channel, is pretty simple. If you need something to move from here to here, that's like saying, I need to put a nail in the wall, and if I hand you a screwdriver or a glass of water, that's not going to get that nail in the wall. What gets the nail in the wall is a hammer. So in a situation where somebody has low GABA, it is absolutely right, proper, and the proper thing to do is to give them a GABA booster, and Xanax is one of those. So let's talk about the dosing notches on Xanax. Xanax, typically, you can start as low as 0.25 milligrams, but Xanax gets in and out of your system typically in 4 to 6 hours. At the lower doses, I think of it as an every 4 hours while awake medication. So if you start someone in a very low dosage, if somebody's very lightweight or elderly, 0.25, a quarter milligram, 4 times a day is pretty standard. And what that's doing, the reason you give it 4 times a day, is not to give a lot of medicine. What you're doing is you're taking that daily dosage and cutting it into every 4 hours while awake segments. So if you wake up in the morning and you're here, you take your first Xanax, it gets you here. About 4 hours later, rather than waiting to have symptoms again, what I tell people to do is take another one. So if you start at 6 in the morning, then your next one is going to be at 10. and then at 10 in the morning, 4 hours later, that's going to be 2 o'clock in the afternoon, take another one, and then at 2 in the afternoon, you take another one, and that's going to get you to 6, and at 6 o'clock at night, you take your last one. So 6, 10, 2, 6 would be every 4 hours while awake. You could do 7, 11, 3, 7. Again, the idea is it's like a candle that burns for 4 hours. Normally, I start people in adults of normal body weight. I start at 0.5 milligrams. So 0.5 milligrams is 2 milligrams per day divided into 4 doses. So again, if you just take the first dose and you're starting here in the morning and at 6 a.m. and you take one, and at 10 o'clock, once it wears out, if you do nothing more, then your GABA drops back to here. Your GABA activity goes low again, so you're more likely to have a panic attack. This is the reason that I don't want people to take Xanax, or I typically don't recommend that they take Xanax or medicines like Xanax on an as-needed basis. Because really, if you're treating GABA and you want your GABA to be elevated, what you want to do is keep it elevated, not have it go up and down all day long. So in the firefighting mode, people will be told, hey, just take your Xanax after you've had a panic attack, or when you think you're having a panic attack. Well, the problem with that is that if you're waiting to have the panic attack, then you're on call sort of, every moment, wondering when is it going to happen again. And the second thing is that once you've had the panic attack, typically you feel really exhausted, and so it's sort of too late after you've had the panic attack. So it's sort of like letting the horse closing the door after the horse has left the barn. So taking Xanax as needed for panic attacks, in my opinion, is often less efficacious than simply having people boost their GABA all day long. So again, with the 0.5 milligram, that would be 4 times a day. So 6, and then 10, and then 2, and then 6. And that is a very standard program for people keeping their GABA up all day long. You wake up the next morning and you're down here. People say, hey, doc, can I just take this once a day? The fact is, if you take all of it once a day, it's going to get out of your system. Now, there are some long-acting preparations of Xanax, alprazolam, which unfortunately, my experience was they didn't work very well. They made people tired. They really didn't last all day long. And so they really, in my view, were not very useful. So I do not personally write a lot of prescriptions for extended release alprazolam products, which have various names. But if you're thinking about extended release Xanax, my experience is they've not been very good. So unfortunately, one of the downsides of taking a medicine like alprazolam is you really do have to take it on a timed basis. And that sometimes takes a lot of work to remember to take it. If people forget, what I tell them is this: if you take your first one at 6 in the morning and you forget and it's noon or 2 in the afternoon, you say, man, I forgot to take my Xanax. We'll take one at that point, and then your clock starts with 4 hours later. So one way to think about it is that Xanax is like a candle that burns 4 hours. Once you light it, it's going to burn for 4 hours. After that, it's going to go out. You have to burn another one. So some people like the candle analogy because honestly, if you forget to light that candle and you go without a candle for 4 hours, well, the next one still only works 4 hours. So no, you don't take double, and you don't get all nervous about what you should have done. Just if you forgot, take another one that day, reset the clock 4 hours, then 4 hours later, then 4 hours later, and that's what your clock is. The third dosage of Xanax is 1 milligram 3 times a day. So when you transition after 2, 3, 4 weeks, just a month of being at 0.5 milligram 4 times a day, which is 2 milligrams, if that's not enough, I routinely will go to 1 milligram 3 times a day. Now that's a 6-hour dose. So it is a doubling of the dose from 0.5 to 1 milligram, but it's also, we changed the timing of it to every 6 hours while awake. So that's a 3 times a day. So that's going to sound like 6, noon, and 6, or 7, 1, and 7. If that's not sufficient after 2, 3, 4 weeks, then it's pretty common to go to 1 milligram 4 times a day, and that's pretty much stacking them as close as we can together. So at that point, if 1 3 times a day is not sufficient to cover somebody and they still have their GABA, we have symptoms of their GABA going up and down with their anxiety coming and going, then 1 milligram 4 times a day is the top dose. Now, why is that the top dose? Why is that what I call the guardrail? For 2 reasons. Number 1, if you go past 4 milligrams, then you're now in the area of tolerance and dependence. So the guardrail of 4 milligrams is really intended for you to not get to a point where it stops working for you. Tolerance is a phenomenon of the medication not working, and once you cross 4 milligrams, in my opinion, and that's pretty well regarded by people that I trust, 4 milligrams is, you don't want to go beyond 4 milligrams. If you're tempted to go beyond 4 milligrams, well, then maybe you've got other problems. You might have a serotonin problem. You might have a dopamine problem. When I don't give more than 4 milligrams, it's because I don't believe that more milligram dosage of Xanax is necessarily going to work. Not only does it expose you to the risk of tolerance and dependence, which is addiction, and having all those problems, becoming physically addicted to Xanax, alprazolam, but it's also indicative that, if you're giving more and more and more and more of one thing, you may need something completely different. So for me, 4 milligrams is the top dose. That's what I call the threshold. That's as far as you want to go. Now, I've certainly seen patients take more than that. I have a lot of patients that come to me from other practitioners who have not regarded the threshold. What I try to do is to get them down to that threshold, so long term, I think that we don't have any problems. Other issues with Xanax, one of the main things is that we want to be careful if you're taking pain medicine. A lot of doctors tell their patients, hey, you can't take pain medications, particularly opiates. You can't take opiates and Xanax. Well, the problem with that is that people have done it for years. And at least where I work in practice, there was a lot of noise, I think, and thought process about you shouldn't be taking Xanax and prescription pain medications like opiates. Well, for the people that have been on them for a decade or two or sometimes 3, to be told that they couldn't do it didn't make a lot of sense, because they'd been doing it successfully, taking Xanax for their anxiety, for their GABA, and taking pain medications, including opiates, for their pain. And if they legitimately have both problems, they should legitimately both be able to take both of those medicines. The true issue with taking Xanax and opiates is not that you should not take them together. It's that you have to be extra cautious. And what we know about taking those medicines together is that if you take an overdose of opiates or an overdose of Xanax, alprazolam, a benzodiazepine, while you are taking opiates, you're more likely to die of the overdose. So the issue is your personal safety. It's not that you will die by taking both, because we know patients have taken both for decades and didn't have a problem. But if you overuse them, take too much, abuse them, you can have a serious, including a life-threatening problem. So when I'm counseling patients about taking the combination of taking Xanax when I know that they're taking pain medicines, it's pretty simple. Do you know that you're not supposed to take too much? Are you careful? Many people say, yes, I don't take them at the same time. That's fine. But the truth is, people that do take them at the same time, as long as they're taking them as prescribed, they're not a problem. So again, this falls into the category of people blame the medicine as opposed to the people that are using them. Xanax, alprazolam, a benzo is not a bad medication. Alprazolam, a benzo, is a medicine that can be misused by people that should not be taking it, and also can be mistakenly misused by people who are taking it. So the people that shouldn't be taking it, and the people that should be taking it should be taken properly. Now, I know that sounds like, boy, that's really a dramatically medical information that you've never heard before. Take your medications as prescribed. Yeah, pretty straightforward. That's what we want people to do. That's common sense. That's common sense approach to any medicine, actually. Xanax is a medicine, as I said before, I use routinely on a daily basis for people who have GABA deficiency. So if you have a GABA shortage and that's what's causing you to have symptoms of anxiety, panic attacks, agoraphobia, which is fear of being in public places, whoever's taking care of you, it's okay to talk about Xanax. I don't believe that you're a drug seeker by asking the question, would I benefit from medicine like Xanax? Certainly, if you shouldn't be taking it, you shouldn't be taking it, but that's between you and your prescriber. And obviously, we screen for the proper patients that should be taking alprazolam, should be taking Xanax. So that's all I have to say on the product specifics of Xanax, alprazolam. I hope this video is helpful to you. I hope the product specific videos are helpful to you, and I plan on doing more. So I'm Dr. Dave, Psychiatry. Thanks for coming to see me today.